Okay, so does a brain tumor always need surgery, or is it any other way of doing this, treating it?
Yes, there are other ways of treating, like gamma rays, like commonly called gamma knife, or X knife, or cyber knife. All of them are radiations basically. Gamma knife has gamma rays, X knife and cyber knife has linear electrons only, highly charged electrons. So all three are radiations. Now, what are the indications for these things? Where the tumor is less than 2 centimeter by 2 centimeter by 2 centimeter in volume. Those are the ideal cases for gamma rays. Number one. Number two, the tumor should not be in an area where it can potentially cause damage post radiation. Because of with any radiation is heating up and burning the tumor. All the three modalities are radiation. So when you're heating it up, it swells up. So a small tumor underneath a vision nerve can swell up and cause deterioration of the vision. So a tumor which is less than 2 centimeters by 2 centimeters by 2 centimeters and not being compromising any eloquent area can be treated by radiation.
And so from the time you started doing neurosurgery to right now,
Yeah.
What has been the technological changes that has helped you as a surgeon? For instance, now you're saying whether to decide on gamma or whether to go in for a surgery.
Yeah.
That decision making, has that improved?
Yes, exactly. There's a tectonic shift, I would say. Like when I was in my residency, I purchased a desktop, which was 73,000 rupees. I took a loan and purchased that. And we have a 4.3 hard disk was this much. Now you have 64 to 128 or 526 GB in a mobile phone. So there's a tectonic shift similarly. Now we have microscopes whereby the depth perception has increased, the light has increased, the wires, the neural fibers, they look 16 times bigger. That means the hairs will look like a pen, a ball pen. So there is an increase in the visualization, the optics, the equipments. Now we have tungsten carbide tipped dissection instruments. So they are much more sturdier, stiffer and sharper. Similarly, the tables, we can maneuver the tables in any which way. MRIs, when I was in the training, it used to be 0.2 Tesla MRI. Now 3 Tesla MRI is commonly commercially used. And probably in next 5 to 6 years, you will get 7 Tesla or 8 Tesla MRI. So the technology has changed the perspectives tremendously. In my days, only there was gamma knife. There was no X knife or there was no cyber knife. So now there is X knife and cyber knife also is there. Probably we will get a proton beam in our country also in a year or so.
Okay. And does this also enable you to see the downside of probably a nerve or something? Since this is
yeah, we can do a tractography, which was not possible nowadays. If I have having a tumor, I can actually do a surgery even before actually taking the patient on table. We have so much imaging tools like tractography, chemical analysis of the tumor, the specialized MRIs, the 3D MRIs, 3D CT scans, angiographies. We actually do the surgery even before doing a tumor, so we know which nerve is going where. That's how I said earlier, the incidence of having a complication in a brain tumor surgery or spine surgery is now reduced to 1 to 5% as it compared to 10% or more earlier.